Hello everyone, welcome to our channel Common Nursing Guide. I hope all of you are doing well. Let's start our video, the nebulization procedure, and I will keep on uploading nursing related videos from today. And firstly we will discuss about the nebulization procedure. Definition. What is nebulization in the nursing? It is a process of giving medication by way of inhalation is called nebulization. When we administer medication to the patient by the ways of inhalation, then it is known as the nebulization. It makes use of a nebulizer to deliver drugs to the lungs through the inhalation of a mist. And what is the process going behind this? When we administer medication by the process of inhalation, it converts into a mist that patient inhales and it delivers to his or her lungs, and this is the process that is going behind the nebulizer. And next is indications. Nebulization therapy, which uses medicine delivery along the respiratory system, is appropriate for a number of respiratory conditions and illness. There are various conditions that are related to respiratory system, and nebulization is the one therapy that we can use to minimize their condition that is going worsen. And here are some indications, like chest constriction. When the chest is constricted, the bronchioles are constricted, lungs are not working properly. And the bronchospasm is a kind when the bronchioles of the lungs are not working properly. Spasm means that are not working properly. And the pneumonia, atelectasis, and the asthma, thick and excessive mucus discharge, congestion in lungs. These are the indications. And what are the contraindications? That we can't administer drugs to the patient by inhalation, or we can't provide to the patient the nebulizer therapy. If the patient's blood pressure is fluctuating, means it is elevating or decreasing or elevated, then we can't provide nebulizer therapy to those kind of patients. Cardiac irritability, if the patient have some cardiac issues. Unresponsive patients means unconscious patients, whether we can provide them, we have to provide them the nebulizer therapy, but it will be according to the doctor's prescription. And what are the equipments that we need to perform nebulizer therapy or nebulization procedure? First, nebulizer and connecting tubes for nebulizer, oxygen compressor tank, mouthpiece and mask, prescribed respiratory medicines, normal saline solution, syringe and needle. If the medication is in the liquid form, then we have to administer that medication by use of syringe and needle. To put it in a nebulizer cup, towel, that is also necessary to wipe off the secretions. And here it is the nebulizer. We talk about the compressor. This is the oxygen compressor tank, and this is the tubing that is attached to the compressor at one end, and the other end is attached to the nebulizer cup where medication is stored, and this is the mouthpiece. Now we can use mouthpiece as well as we can attach mask here to that mouthpiece if the patient is not able to do so, like in condition when we have to use the mouthpiece, the patient needs to be close his or her lips tightly so that medication can be inhaled properly, and if patient is not able to do so, then we can attach the mask here. That will automatically ease their situation. Now the procedure, the nursing students know that we have to tell the examiner like a sterile tray containing the medications, the paper bag, the kidney tray, and all that material that will be necessary for starting each and every procedure. And now we will discuss about that. The patient should be properly positioned to allow for adequate breathing. The breathing will be eased. That position we have to provide to the patient. Evaluate and keep track of your breathing patterns and respiratory health, heart rate, and other important respiratory processes. When we are going to administer the nebulizer therapy or the nebulization procedure, firstly we have to keep track on all of these health status. Teach the patient how to breathe properly, like slow mouth to mouth breathing using the mouthpiece. When patient is using the mouthpiece, then the patient have to close the lips and have to inhale that medication. A brief pause follows the inspiration. When the patient inspires once, then he or she have to pause for a second and exhale completely and slowly. And before taking another big breath, pause for a moment. We have to inhale and then pause, exhale, and this will keep on going. And next, prepare the available equipments. We already discussed about the equipments. Examine the prescription of drug and then get ready. Always look for the prescription of drugs, like what the drugs the doctor has prescribed. We have to cross check that. Add the prescribed quantity of saline solution while adding the drug to the nebulizer. We have to mix the saline solution and the drug and then put it in the nebulizer. Connect the nebulizer to the source of the compressed air. Like we already talked about, one end of the tubing is connected to the oxygen compressor tank and the other piece is connected to the nebulizer. Connect the nebulizer's connecting tubes and mouthpiece. Switch the device on. Notice the mist produced by the nebulizer. Yeah, this is the one thing that we have to notice. If the mist is producing, we can make sure that the device is working. Offer the nebulizer to the patient and provide support until he is able to inhale properly. In pediatric, geriatric, or unusual instances, if the patient is unable to hold the nebulizer, replace the mouthpiece with the mask. Like the patient, if pediatric, like in the case of kids or the older population, we have to use the mask instead of mouthpiece. We have to connect mask with the mouthpiece so they can inhale properly. And the next is, until the drug is consumed, keep on going. Re-evaluate the patient's condition based on breath sounds, respiratory status, heart rate, and any other important respiratory functions that are required. When the patient is having the nebulizer therapy, we have to evaluate these status. The patient is okay. If the patient's breath sounds are not appropriate, then we have to stop that therapy at that time and consult with the doctor. Here are some complications that results from nebulizer therapy: palpitations, tremors, tachycardia, headache, nausea, bronchospasms. And here are some tips for you guys, like for putting a great impression on your examiner, you have to tell the position, which position we should provide to the patient while having the nebulizer therapy or nebulization procedure. That is upright sitting or semi-followers position, because the semi-followers position is best for lowering the shortness of breath. And the second one is, can we mix water in nebulization? No, never ever do this one, because it will stimulate bronchoconstriction. The patient's breath will collapse. Like, never ever do this. How long to nebulize the patient? It will be 5 to 15 minutes, or when the medication is finished, or according to the doctor's prescription. After nebulization, when the process of nebulization is done, encourage the patient to deep breathe and perform coughing exercises so the mucus can be expelled. Like, after having the nebulization therapy, encourage the patient to deep breathe and perform coughing exercises so that the patient can expel out the mucus or the secretions that are inside. And what are the medications that we can use for this? Albuterol, budesonide, formoterol, fluticasone, and salmeterol. These are the medications that we can use. And the dose: albuterol must follow the prescription. Guys, for having this procedure or any other procedure, we have to follow the doctor's prescription at all the time. Okay. And for adults and children older than 12 years, we can administer 2.5 milligrams, and for children 2 to 12 years, we can administer 0.63 to 1.25 milligram. And this is all about my presentation, so I hope you guys understand it well. And one more thing, all of the medications have different doses, so if you want to let me know, guys, if you want video on this topic, like different medications along with their doses for the nebulization procedure. And please comment below the topics that you want to be shared by me. I will be more than happy to do so. And from now onwards, I will keep on posting the videos related to the nursing procedures or the nursing syllabus. I hope all of you will understand this topic. Okay guys, I will meet you in another video. Have a good day ahead.